Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Hi there, and welcome back to Plantar Plate Imaging. Let's take a look at part 4, dynamic ultrasound evaluation of the plantar plate. Anatomic considerations in the classic crossover toe deformity. This is the situation where you have a plantar plate tear that has occurred usually on the lateral border, in this case at the second metatarsal phalangeal joint, and that has created a situation that has allowed a metatarsal rotational malalignment. That second toe is now flexed at the PIP joint and able to cross over to the great toe. This is going to create a good amount of pressure between the second toe and the first toe, and an ulcer can form. And that can have devastating complications for our diabetic patients. And furthermore, accurate diagnosis early on may help to avoid and prevent these types of malalignments that can put our patients at future risk. Let's take a look now at the Mulder's maneuver. The Mulder's maneuver is where we're going to compress the foot from medial to lateral and be able to create a situation where an interdigital lesion may become more conspicuous on ultrasound with medial to lateral compression. In this case, we can see that there is fullness of this interspace as a compression between the first and the fifth occurred to create a situation that had an audible click, where we were able to see the protrusion of the interdigital nerve pushing along the deep transverse intermetatarsal ligament. Let's take a look at this dynamic ultrasound of this Morton's maneuver. We can see in this region this interdigital nerve seen as a hypoechoic lesion pushing through the region of the deep transverse intermetatarsal ligament, and of course partially reducing in this situation that has likely a tear also of the plantar plate. So that is an example of how Mulder's maneuver can create a more conspicuous situation where we can see the interdigital nerve creating a protrusion through the level of the deep transverse intermetatarsal ligament, a situation that can be addressed using the Mulder's maneuver. Anatomic considerations when we're looking at MTP joint instability, it's good to understand Lachman's MTP drawer test. And that will be helpful to assess the degree of subluxation or dislocation under stress. So in grade 1, the joint is less than 50% dissociable. Grade 2, greater than 50%. Grade 3, completely can dislocate it. And grade 4, it's dislocated at rest. When we're taking a look at these things, we can really see with clarity under ultrasound the anatomy of the plantar plate. So in this example, we have the sagittal plane loaded up here. We have the second MTP joint, and this is the normal appearance of the plantar plate as a labral-like, slightly echogenic structure, which is generally homogeneous. And we can see that it's going to blend imperceptibly here, this region here, to the level of the flexor tendon. We can see this is the flexor tendon with the flexor tendon fibrils. So the plantar plate. And of course, deep to that, we have the hyaline cartilage of the metatarsal head. We have the proximal phalangeal base with its cortical bone and the intramedullary bone. And in this case, we can see an actual tear of the plantar plate. So where we had that labral-like, slightly echogenic structure, now we have this hypoechoic area of discontinuity seen in a plantar plate tear on ultrasound. Looking at the Lachman's maneuver for plantar plate tear, we can appreciate using that dynamic maneuver here, where we're going to take the proximal phalanx seen at the left of the image, and we're going to dorsiflex that, and we're going to understand the relationship of the region of the plantar plate seen with the hypoechoic tear seen here, the plantar plate itself seen here, the flexor tendon seen here. And we can see that region of hypoechoic. We can also measure the degree of subluxation of the proximal phalangeal base relative to the metatarsal head, and we can gain a measurement of that to have a reproducible example for our clinicians. So we can measure that between here, and of course, we will have an understanding of the metatarsal head size, and we can see in this case it was less than 50%. So less than 50% dissociable, and we see an actual partial tear of the plantar plate. So a partial tear, low grade, plantar plate less than 50% subluxable. And of course, here we can see that in a static image, that hypoechoic rent seen within the region of the plantar plate. In this example here, we can see even before we begin that the level of the proximal phalanx is on a level that is not sweet to the level of the metatarsal head. And of course, when the patient begins to have a toe off, they're going to actually reach the ground with the proximal phalangeal base first, which will certainly set up a lot of dysfunction. But let's take a look. And what we're seeing here at the proximal phalangeal base, as we plantar flex this, we're beginning to have a situation where we can dissociate the articulation. We're seeing a partial tear of the plantar plate itself as it attaches on the proximal phalanx, this rent here. Of course, we can see that it's going less than 50%, and we're going to then sublux or attempt to try to sublux this articulation. Noticing the tear here. It's less noticeable as we move from medial to lateral. So as we can see here, we can see the tear with a greater degree of conspicuity off to one side. And then as the operator moves from medial to lateral, we can appreciate that is not a full thickness transverse tear. So again, a partial tear, less than 50% subluxation of the plantar plate. And we can see that with clarity on this ultrasound. Are you ready to take your podiatric imaging skills to new heights? Check us out at RadPodSquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.